A question that's had a fair amount of controversy surrounding it over the last 2 to 3 years is what's the optimal induction regimen for a newly diagnosed myeloma patient? And I think it's important to realize that it's clear now in 2016 that combination therapy represents the best way to move forward. So that typically represents a 3-drug combination versus either a 2-drug doublet of bortezomib and dex or lenalidomide and dexamethasone. Now, there has been a big question about whether bortezomib should be combined with cyclophosphamide or old-fashioned chemotherapy with dex, so the VCD regimen, or whether it should be combined with lenalidomide and dexamethasone. And there were 2 trials presented in the last year that really helped us to answer this question. The first is, in a phase 3 trial, RVD clearly beat lenalidomide and dexamethasone, so a 3-drug combination beat a 2-drug combination in terms of how long patients stayed in remission and in terms of overall survival. And this was the first phase 3 trial using RVD as induction, and it's an important data set for us to have because now we have phase 3 data demonstrating significant improvement for bortezomib, lenalidomide, and dexamethasone in combination. That phase 3 data supporting the use of VCD, bortezomib with Cytoxan and dexamethasone, does not exist. And so the only data we have was a head-to-head comparison of VCD with VTD. So the RVD regimen I mentioned earlier, but substituting thalidomide, the older IMiD, in for the lenalidomide. And what we learned again in the last 6 months is that the IMiD combination with bortezomib, VTD, was clearly superior to the cyclophosphamide combination with bortezomib or VCD. Now, this all gets very confusing, and the acronyms can be very challenging to keep track of. But the take-home message, in my view, is that the role of traditional chemotherapy, alkylating agents, Doxil, doxorubicin, cyclophosphamide, as part of initial induction therapy is being replaced by the use of a proteasome inhibitor and an IMiD together, the RVD regimen, and that regimen in 2016 represents the standard of care for almost all newly diagnosed myeloma patients.